Hello and welcome to the AUA Focus Series, a podcast channeled by the AUA Media Lab. My name is Hratchia Lylozian, Research Associate at the AUA Turpanjian College of Health Sciences. And today my guest is Dr. Shant Shekherdimian. Dr. Shekherdimian, thank you for joining us today.
Thank you for having me.
Before we begin, I would like to take a moment to present you to the audience. So Dr. Shant Shekherdimian is an associate professor of pediatric surgery at the University of California, Los Angeles, and currently serves as the interim chief of division of the pediatric surgery. Beyond clinical practice, Dr. Shekherdimian is also deeply engaged in global health, particularly in Armenia, where he has played a pivotal role in health policy reform, primary care strengthening, and medical education development. He serves as an advisor to the Ministry of Health of Armenia, spearheading initiatives on graduate medical training, healthcare licensing, and healthcare quality improvement. His contributions have led to impactful publications, international presentations, and the establishment of Armenia's Pediatric Vascular Access Program. Once again, welcome, Shant.
Thank you.
I would like to start off with my first question. And how do you find time to do all this?
It's all sort of packaged into to life, I guess, as we've defined it. I'm fortunate enough to have the support at home, the support at work to allow for a lot of the away time, to allow for the experience of moving to Armenia for the couple of years that we were here. But, you know, it's once you... And we don't ask ourselves that question when we have kids, for example. You just make time because when you enjoy something, when you're passionate about it, it's almost as if time, it's never infinite, but you can fit a lot more things into your life, your career, your work week, if you let it all pass with enjoyment and passion, I guess is the best way of saying it.
Yeah, thank you for that. So let's start with a broad overview. What are the biggest challenges facing Armenia's healthcare system today, and how have they evolved over the past decade?
Okay. Well, one of the things that frequently coming to and from Armenia allows you to do is sit on an airplane for a long period of time and really think and ruminate over things. And obviously this question comes up a lot. And a couple of trips back, I was thinking about this and trying to come up with a better way or a more concise way of answering that question. And this mnemonic came to my mind, which was PQR. It's always easy, especially in medicine, to remember things with mnemonics because there's so much to remember. ABCs is airway, breathing, circulation when you talk about how to resuscitate a patient. So PQR is the way I think of it. And I almost make a triangle in my mind if I can have that conceptualized to others. On the peak of that triangle or pyramid is sort of this ambitious goal to implement universal health coverage in Armenia. But to get to that, we need the base or the fundamental of that pyramid, which is the P and the Q. Mm-hmm. P being the primary care system, a strong foundational primary care system, which, if we want to define that, is the only branch of healthcare that is actually healthcare. Everything else is sick care. And so you must have a strong primary care system to keep the population healthy, to prevent disease, and to intervene early and do things much more cost effectively. The other sort of foundational element is the Q, which is quality. So we have some data on the quality of care in Armenia, and maybe we can go into that a little bit later, but suffice it to say that we have issues with delivering high or optimal or better quality of care. And that's the other fundamental area that I think needs to be addressed and will serve as a foundation for ultimately achieving the peak of that pyramid, which is universal healthcare. But in order to get to that is the R, which is the ability to reform. And that speaks to governance and policy-making improvements, because we can have the strong foundation, but then we need to have the ability to govern the system and to take those fundamental elements and get us up to this ambitious goal of universal healthcare.
Thank you. Yeah, universal healthcare and universal health insurance has been a hot topic of discussion in Armenia lately. And what steps are being taken towards implementing a universal health insurance system? And in your opinion, what challenges need to be addressed to make it a reality?
Yeah, so I would say I would go back to that triangle. So studies have shown in countries and other low to middle income countries that have implemented universal healthcare, virtually all of them will afford the population financial protection. So spending on healthcare becomes a little bit more cushioned and less traumatic, if we can call it that, less catastrophic. However, in most of those countries, they have not noted any healthcare benefits. And the reason for that likely is that those foundational elements of a strong primary care system and high quality healthcare were likely not addressed or not addressed to a sufficient level so that you can achieve the main goals of universal healthcare, which again are not only financial protection. Yes, we want our population to spend less on healthcare and for everyone to have no financial barriers to accessing healthcare, but we also want that healthcare to serve its purpose, which is to keep the population healthy, to effectively and cost effectively treat disease. And so why universal healthcare? I think it's pretty self-explanatory. It's probably the most effective single thing that we can aim to achieve that will have the biggest return on investment, but also the most complicated. Sorry, I think your question said what steps have we taken? Broadly speaking, I would say that the government of Armenia has attempted to achieve the modeling of universal healthcare on the financial side, because there's a lot of complexities to that. And I'm sure many of the viewers and many of us have experiences on how healthcare is financed in other countries. There's no one-size-fits-all model. There's some good evidence to show that some models work better than others. But each country has to decide how to fund it, who's going to service or be the quote-unquote insurance provider for their country. Is it going to be a marketplace? Is it going to be a single provider, et cetera? So a lot of work has been done on modeling that, and that's been on the governmental level in collaboration with other ministries that are engaged in this, such as the Ministry of Finance, and et cetera. The other one is going back to the foundation of that pyramid that we talked about, which is priming the system and getting it ready for the implementation of universal healthcare. Once the technicalities of how it's going to be funded and modeled are taken care of, we still want to make sure that we don't fall into those series of countries that now pay for more healthcare but don't see any healthcare benefits from it. And so along those lines, just to keep it short, there's been a lot of effort, maybe more so on the primary care strengthening side of that foundation, but also some work on developing sort of national quality strategy and other elements or other mechanisms to assure a minimal level or an improved level of quality in the healthcare system, such as licensing of providers, which has been a topic of hot discussion, is currently being implemented.
Yeah. What do you think about public-private partnerships in healthcare? This topic has been discussed extensively as a way to strengthen health systems. And what role does the public sector play in Armenia's healthcare compared to the private sector? And how can partnerships between the two be improved?
So great question. A little intimidating, I have to be honest, because this is not an area of expertise for myself. I also come from the United States, and there are some biases or there are some firsthand experiences about the role of private sector in a setting like that has, without getting into too controversial of topics, has created a system that is overwhelmingly too expensive and delivers outcomes that are subpar to many other high-income countries. But if we leave that bias aside, and maybe if we can just talk about this in broad strokes, obviously there's a lot of history here. So we historically, during Soviet times, there was no private sector. And then there was rapid privatization post-independence. And now we are trying to find that right balance. I think the idea of private-public partnership is very, very worthwhile, but I think it can only be effective and done well if there are strong rules and regulations, if we can call it that, or guiding principles, and the private sector is not left completely unregulated or without any oversight or with minimal oversight. We frequently talk about this idea of competition in healthcare, and there is a role for competition. But I think the most important thing to keep in mind when we talk about healthcare is in difference to other sectors where competition can certainly increase quality or drive down costs. There is a fundamental difference here in that the patient can never be an informed consumer like how we can be informed consumers when we're buying any other product, and where competition or the market principles work in our favor. So I think someone, something, some entity has to be a advocate of the uninformed consumer, the patient in healthcare, and make sure that the competitive forces don't lead to extraordinary costs or poorer quality healthcare.
Thank you. The Armenian diaspora has historically played an important role in Armenia's development. How has the diaspora contributed specifically to the healthcare sector, both in terms of funding and expertise?
Okay. This is going to get me in trouble probably, but I'll just share some maybe unfiltered thoughts. Sometimes I think I'm extreme in my opinions on this, but maybe there's a role for that because there's always a regression of the mean, or there's the truth is somewhere in the middle. But on one of my other flights, returning from Armenia, I was thinking about this. And maybe if we put on our public health hats or our healthcare hats and looked at this more scientifically, I hate to answer your question with a question, but I would pose the following question to everyone, which is let's take any other country that is similarly resourced to Armenia, has a similar cultural background, similar geographic territory, similar economics, as close as we can get, but no diaspora, which should be easy to find because we're one of the few that has a significant diaspora. And let's compare outcomes. We frequently talk about diaspora being this tremendous resource, huge contributions, which maybe numbers-wise, absolute dollar-wise, may be true. But what if we compare ourselves to another country that has no diaspora but very similar background? Can we really find an area or a metric where we have been able to shine in healthcare and develop some outcomes or achieve some outcomes that other countries have because of this big resource that we have? And I'm hard-pressed to find it. I'm sure there are examples out there, but I think globally speaking, if we think about it from that matter or from that perspective, we would come to the conclusion that at the minimum, the diaspora resource is not optimally channeled and has not led to the more potential bigger impact that it could have. So there's something there. There's something amazing there. We have a lot of work to do in terms of figuring out the science behind harnessing that potential and using it to the maximum benefit to Armenia's healthcare system. Let me just say two other sort of side notes about this. The first one is that as difficult as this is, we also need to have some honest and frank discussions about sometimes the potential harm that could be caused by any, not only diaspora, but any engagement in a healthcare system by any stakeholder. And we need to talk about those. We need to be mindful of those, and we all collectively need to make sure that we minimize those potential side benefits. And the final thing I would say, just to end on a positive note, is all of this may have painted a very negative picture, but of course, undoubtedly, there are some pockets of excellent diaspora engagement, excellent diaspora programs and partnerships. And there are also some new and exciting ideas that are also now arising, which we are all very excited to see the results of and hopefully use as case examples of how we can do things better in the future.
Can you share some examples of impactful initiatives led by Armenian diaspora and organizations or individuals that have strengthened Armenia's health system?
I think maybe can we refine the question and say maybe not led by the diaspora, but with contribution of the diaspora? Because in fact, one of the important elements in my mind would be that all of this be done in partnership with local stakeholders, whether it's public, private, educational institutions, or whatnot. It's a great question. Maybe this is the one question I should have thought of more before, and maybe done some research and understand and come up with an exhaustive list. And I feel conflicted in giving the examples that come to mind because they would necessarily exclude the many others out there that are not coming to mind. But since you asked, I think, for example, the Armenian Eye Care Project is an example of a program that has stood the test of time, that has really sort of a multifaceted approach and has focused not only on the delivery of clinical care, of patient care, but also quality, but also medical education, also research, monitoring, and evaluation. And so that's one that comes to mind for historically from the organizations and activities that have involved the diaspora. More recently, there's a couple of programs that have been very exciting for me, and I see great potential in. One of them is a program called Health for Armenia, which is based on a model that was developed in education under the name of Teach for Armenia. And the idea is that physicians spend time in rural areas of Armenia providing care, but not only providing care, but using this opportunity to spend a couple of years embedded within areas that have even more healthcare need and understanding really the root issues, challenges, as well as opportunities in Armenia's healthcare. And then during that time, also fostering a leadership development mindset through a formal leadership development course, and coming back and seeing these physicians become the next generation of healthcare leaders for this country. And so I think that's one project that's been very exciting for me to hear about and be a part of. Another one is a new sort of pilot program that is being implemented in a new approach to medical education, and that's a pediatric residency program that really seeks to turn upside down the current model of postgraduate medical education from the finances, where residents in this program actually get paid, like residents where I also work in the United States get paid and don't have to pay, like other residency programs here, where there is an updated curriculum, an updated faculty development program, and other components that bring it in line with international standards. And I highlight these programs because I think they are more potentially foundationally changing the important elements of Armenia's healthcare system, and less on the side of quote-unquote simple clinical care delivery.
Yeah. So looking ahead, what are the next steps for fostering deeper and more structured collaboration between the Armenian government, healthcare institutions, and the diaspora to improve health outcomes?
So I think a lot of things have to go into this. Maybe we can start with the higher level division, which is Armenia needs to better develop the ask and also better able to harness the potential of the diaspora, right? That's the pull. And there's certainly a lot Armenia as a whole can be doing for that. Rather we take it all, one size fits all approach, anyone and everyone from the diaspora, the answer is yes, come. but really not have a unified, aligned strategy. So that's on the pull side. On the push side, I think the diaspora needs to continue to organize. I think we need to be talking more openly and honestly about the priorities in healthcare. What are evidence-based approaches to meaningfully engage? And there's precedent for this. We may be one of the countries with a big diaspora, but we're not the only external stakeholder involved in healthcare improvement in other countries. There's a lot of science behind it. There's a lot of examples and success stories that we can learn from. So I think further organization, maybe unification, but it's not about everyone having the same approach. It's not about everyone thinking the same way, but it's about aligning towards priorities and doing things that are more evidence-based. That I think is the push from the diaspora side. And I think there's still a lot of room for trial and error. It's not going to be perfect, but I think if we do a better job on the diaspora side, and if we do a better job on the Armenia side, I'm very fortunate to put myself in both baskets because it's an amazing experience to be on both sides, then I think we will find a better fit and we will be more effective.
Dr. Shekherdimian, thank you for sharing your insights and experiences with us today. It's clear that there are both significant challenges and exciting opportunities in Armenia's healthcare sector, and your work in health system strengthening and diaspora engagement is truly inspiring. Thank you for that.
Thank you for this opportunity.
And to our listeners, thank you for tuning in to this episode of AUA Focus Series.